Welcome back to Sault Ste. Marie. I know you make several trips here during the course of a year, and we really do appreciate you joining us this morning. I did receive a couple of emails from a couple of listeners that had some questions for you, and I wanted to pose those to you. The first one comes to us from Allison, and Allison is wondering, if reelected, do you support enabling the privatization of Social Security and Medicare?
Well, you know what I want to be sure that happens is that Social Security and Medicare are preserved so that they're there for not only today's veterans, today's seniors, but for seniors in the future.
Sure.
You know, the way things are now, both Social Security and Medicare are going to be bankrupt within like 20 years.
Oh, really?
So there has to be some changes made. But I think that people should have options. Mm-hmm. I think that, nobody should be affected who is currently at or close to Social Security age.
Right.
But we need to make some changes to both those programs to make sure that they're there for the long term. And that's what I've been supporting.
Jamie sent in a couple of other questions. Jamie wanted to know, do you support a 23% national sales tax?
Well, the Democrats have been distorting my issue and running an ad. Mm-hmm. I've supported several different programs that would simplify the tax code.
Okay.
And to streamline it. My record shows that I've never voted to raise taxes on the middle class. Mm-hmm. I've always been in favor of tax cuts, frankly. I'm a Republican.
Sure.
We don't raise taxes. We try to keep taxes low. And, my record shows that.
The last question that Jamie sent in is, did you vote against, or why rather did you vote against the Paycheck Fairness Act?
Well, just before I got elected, they passed a law that made sure that women have equal pay for equal work. And I frankly believe that absolutely that women should get equal pay for equal work. But we just passed a law that did that.
Okay.
So, that was before I got here. That was in the first 2 years of Mr. Obama's term. So I don't understand what exactly should be changed from that. I mean, is that law wrong? And, they passed it, and, I support equal pay for equal women.
That being said, obviously jobs is a big one for not only us in Michigan, but across the nation, isn't it?
Well, from what I can tell, from people are telling me around the district is that, hey, the economy is not doing as well as it could be. Mm-hmm. I mean, people are not getting raises. People are not getting bonuses. People are just happy to have a job.
Right.
And a lot of that is due to the regulations that are coming out of Washington. As you may know, we've had several big projects in northern Michigan canceled because of, regulatory overreach from like the EPA. We had a road in Marquette to the mine, a 22-mile road, which would have extended the life of the Eagle Mine in Marquette by 10 years, was canceled by the EPA, although every elected official in the state, Democrat and Republican, was in favor of it.
Right.
Those are the kind of major projects that get killed from Washington. We need to put a stop to that. The president's health care bill has been killing jobs as well. Grocery stores, county government. I mean, here in Chippewa County, the county administrator told me they've had to cut back hours on their sheriff deputies because of Obamacare. And, that hurt him to the core because,
right.
He had, people trying to raise a family on 35 hours a week. Mm-hmm. And then he had to cut them back to 29 because the county simply couldn't afford health care for those people. Those are real jobs that get affected by the president's health care bill. And, I want to have health care reform that lowers costs.
Sure, yeah.
I mean, a lot of people have been affected where their insurance has gone up, their deductibles have gone up, or they've lost their insurance. Mm-hmm. We need to have some patient-centered reforms that actually lower costs.
As a surgeon, or I guess, well, technically you're still a surgeon. I don't want to call you a former surgeon, but as a surgeon, dealing with insurance companies is something that you had to do on a day-to-day basis in your previous job. Is that a part of the issue? Is the insurance company and the insurance industry as a whole part of the issue and part of the reason why we need something to
Absolutely.
happen?
One of the big issues that we have is the fact that, one of the reforms that we should make is to make it easier to buy insurance from multiple different companies. Mm-hmm. Like I always like to use the example of car insurance. If you want to buy car insurance, you can buy car insurance from any one of 1,000 companies anywhere in the country. The competition for your car insurance business is brutal. You know, there's Geico, Progressive, State Farm. You know, they're just fighting for your business. In healthcare, it isn't like that. I mean, you can only buy insurance from a company in your state that's subject to all these rules, by both the state and the feds, that make it really expensive. You know, why can't you have more choice in the kind of insurance you buy and pick and choose what kind of coverage you want to, you know, make it best for you? And why is it that you have to get your insurance through your employer? Why can't you do that, get the same tax benefit as you bought it individually? You could take it with you from job to job. Sure. I mean, why do you have to change insurance just because you change employers? That doesn't make any sense. And people have the opportunity to shop. You can get a better price. I want to come back around here real quick, and one of the things that we were talking about just a few minutes ago was jobs and projects that seem to be getting knocked off at a federal level. One of the major jobs that we were kind of looking forward to seeing here in Sault Ste. Marie was the renovation or the reconstruction of the Sault locks. To the point where there's a nice building right down on Portage Avenue that's supposed to house the individuals that are repairing and replacing the locks. Is that a dead issue at this point, or is it something that we could come back to? No, that's a very important issue that we keep raising in Washington to try to get, you know, a new lock to replace the pole. Right. Because that's only a single lock, but a lot of our shipping depends on. I've been working hard to make that happen. You know, unfortunately, the progress is slow. Although, you know, the funding for the what they call the Harbor Maintenance Trust Fund, the money that shippers pay into a pot, they've been spending that in Washington on other stuff. So this last bill that we passed allows more of that money to be spent on water projects, especially here in Michigan. So there's going to be some more funding for the studies that lead up to a new lock. But believe me, I've been working on that project like crazy, trying to get that approved, but it's a slow process. Congressman Dan Benishek joining us this morning here on Eagle 95.1. It is 9:41, 41 minutes after 9 o'clock. One of the issues that's near and dear to your heart is veterans and obviously the VA, having worked there as a surgeon and also having helped many veterans over the course of your career. How are we doing at a state level and at a federal level with helping those men and women that have served our country for so long? Well, you know, the VA has been subject to scandal, as you know, over the past year, and we in the committee, on the Veteran Affairs Committee, have been trying to bring all this to light. And you know, I'm glad the news media took hold of it, and we got a new secretary. That's a really good first step. But we need to hold the VA accountable for the mismanagement and really malfeasance that's happened to many of their employees. So, you know, we're working hard. We just passed a major reform bill to allow veterans to get access to health care locally in the private sector, rather than have to go to the VA and travel long distances. So that's happening. But implementing that new law is something we have to keep an eye on. Actually, I met Bob McDonald, the new secretary, and I was pretty impressed. You know, he's from the private sector. He's the former CEO of Procter & Gamble, so he's got a lot of management experience. And I'm hopeful that with the new law and with his leadership that we have some major improvement there. But certainly it is a frustrating process. The one thing I will say is that if there are veterans out there that are listening, that if you're having a problem with the VA, that our office wants to hear about it, because we can help veterans on an individual basis get the benefits that they deserve. Well, and one of the things, too, that we want to point out is it's not the doctors and nurses at the VA. It's an administrative issue, isn't it? The doctors and nurses... Right. No. I mean, as a doctor working at the VA, I was always complaining about, you know, how can you be doing that? You know, they would make these decisions at the upper levels that didn't make any sense, and they wouldn't listen, frankly, to the doctors and nurses who are taking care of the patient because they had their own misguided ideas. Well, frankly, I could bring that experience to Congress and talk to the people in charge, and we've been able to get some significant improvements, you know, locally. Yeah. Now, do you have office hours today here in Sault Ste. Marie? Are you going to be meeting with constituents? No, I'm going to the school to check out the vocational ed center, see how they've been improving there. That's one of my projects, is trying to improve vocational education throughout the district, because you know, here in the Sault, you got a pretty nice vocational education center.
Right.
But a lot of the areas in the district do not.
Right.
And a lot of our kids sort of have been suffering because, frankly, the kids in high school don't have the options to take a lot of voc because the state and the feds have limited the curriculum so that they don't have an opportunity to explore those fields. And there are jobs available in some of those fields.
Right.
And we should be promoting voc wherever we can. Our office has been working with, high schools, community colleges, and businesses to try to make sure that the community colleges and high school teach toward the jobs that are available. And,
not teach towards a test that they have to pass so that the teacher
right, or,
like that?
get people into a pre-college curriculum that doesn't lead to a job.
Right.
We need to be sure that our kids realize that there are some jobs that don't require a 4-year degree, a 1-year certificate, or a 2-year technical job, or a trade. The trades are hiring.
Right.
And we need to get people in the trades that, these jobs are good paying jobs. You can buy a house, you can raise a family on a lot of the trade jobs that are available now. So we need to be sure that our kids know that they're available and to improve the access to that training.
One last question. You got to love local radio. People are texting me questions for you here this morning. If reelected, what is number one on your list of priorities? What's the number one thing on your agenda that you want to see accomplished?
Well, I think that making the economy better is the number one, to make sure that there are more jobs that pay in the range that you can raise a family on. And, having the energy economy is a good example. I mean, this administration has been killing energy jobs, the Keystone Pipeline, other pipelines around the country that would give us rise to jobs. That we need to get this economy moving so there's more jobs.
Congressman Dan Benishek, I want to thank you very much for joining us this morning. Look forward to talking to you again in the future. And thanks for fighting the good fight for those of us in the 1st Congressional District.
All right, thanks for having me on, Paul.
We really do appreciate it. Let's get back into the classic hits at random. Here's Pat Benatar on Eagle 95.1.